Restless Legs Syndrome, Understanding the Unsettling Discomfort. Get access now, learn more. Introduction. Restless Legs Syndrome, RLS, is a relatively common yet often misunderstood condition that affects people of all ages. In this article, we will delve into the world of RLS, exploring its symptoms, causes, diagnosis, and treatment options, while also shedding light on how it can impact the quality of one's sleep. What is Restless Legs Syndrome? Restless Legs Syndrome, often referred to as Willis-Ekbom disease, is a neurological disorder characterized by an irresistible urge to move one's legs, usually due to uncomfortable sensations. These sensations are often described as crawling, creeping, tingling, burning, or itching. Symptoms of Restless Legs Syndrome. Leg discomfort. The hallmark symptom is a deep, overwhelming discomfort in the legs, often accompanied by a strong urge to move them. Worsening at rest. Symptoms typically worsen when you're at rest, such as when sitting or lying down. Relief with movement. The discomfort is temporarily relieved by movement, such as walking or stretching. Evening and nighttime aggravation. RLS symptoms often peak during the evening or at night, disrupting sleep patterns. Disturbed sleep. RLS can lead to poor sleep quality, causing daytime fatigue and mood disturbances. Causes of Restless Legs Syndrome. The exact cause of RLS remains elusive, but several factors have been associated with its development. These include genetics. A family history of RLS is a significant risk factor, suggesting a genetic component. Iron deficiency. Low iron levels in the brain may trigger RLS symptoms. Dopamine imbalance. RLS may be related to imbalances in the brain's dopamine system. Pregnancy. Some women experience RLS during pregnancy. Chronic diseases. Certain chronic conditions, such as kidney disease, may increase the risk. Early warning signs and risk assessment. Restless Legs Syndrome, RLS, can often present subtle early warning signs that, if recognized, may lead to an early diagnosis and effective management. Understanding these signs and conducting a risk assessment can play a vital role in addressing RLS promptly. Early warning signs. Minor leg discomfort. In the initial stages, individuals with RLS may experience mild leg discomfort, often described as a slight restlessness or a vague sense of discomfort. Paying attention to these early sensations can be the first step in recognizing RLS. Intermittent symptoms. RLS symptoms may not be constant. They might come and go, making it important to notice when these sensations occur and any patterns that emerge. Family history. If you have a family history of RLS, it's a crucial early warning sign. Genetics plays a significant role in the development of RLS, and being aware of a family predisposition can prompt early monitoring. Difficulty falling asleep. Many individuals with RLS struggle to fall asleep because of the discomfort in their legs. If you find it challenging to get comfortable in bed due to persistent leg sensations, it's worth considering RLS as a potential cause. Additional risk factors. Family history. RLS often runs in families, suggesting a strong genetic link. If a close family member has RLS, your risk of developing the condition may be higher. While the exact genetic factors involved are not fully understood, a hereditary predisposition is a well-documented risk factor. Age. The risk of developing RLS tends to increase with age. While it can affect people of all ages, it is more commonly diagnosed in middle-aged and older individuals. However, RLS can also occur in children and young adults. Gender. Research indicates that women are more likely to develop RLS than men. Hormonal changes, particularly during pregnancy and menopause, may play a role in this gender disparity. Chronic medical conditions. Certain chronic diseases and health conditions may increase the likelihood of RLS. These conditions include diabetes, peripheral neuropathy, and kidney disease. Managing the underlying health issue is essential to alleviate RLS symptoms. Medications. Some medications have been linked to the development or exacerbation of RLS symptoms. These medications may include antipsychotics, antidepressants, and certain cold and allergy medications. If you suspect your medication is contributing to your RLS symptoms, consult your healthcare provider for potential alternatives. Additional diagnosis and evaluation. Clinical assessment. A comprehensive evaluation by a healthcare provider is essential for a proper RLS diagnosis. This assessment typically includes medical history. Your doctor will inquire about your symptoms, their duration, and any family history of RLS. Physical examination. A physical examination helps rule out other conditions that may cause similar symptoms. Blood tests. blood tests may be conducted to measure iron levels and rule out iron deficiency, which can contribute to RLS. Sleep study, polysomnography. In some cases, a sleep study may be recommended to evaluate sleep patterns and confirm the presence of RLS. This study can also help identify other sleep disorders, such as sleep apnea, which may co-occur with RLS. RLS rating scale. To assess the severity of your symptoms, your healthcare provider may use a validated questionnaire called the International Restless Legs Syndrome Study Group Rating Scale. This scale helps quantify the frequency and intensity of RLS symptoms and is useful in tracking treatment progress. Differential diagnosis. RLS can mimic the symptoms of other conditions, such as peripheral neuropathy, leg cramps, or nocturnal leg muscle pain. Therefore, a differential diagnosis is crucial to distinguish RLS from other conditions with similar symptoms. Brain imaging. In some cases, brain imaging, such as magnetic resonance imaging, MRI, may be recommended to rule out other neurological conditions and confirm the absence of structural abnormalities in the brain. The connection between RLS and sleep. Sleep disruption. RLS can profoundly disrupt sleep patterns, as the discomfort and urge to move the legs are often most pronounced during the evening and nighttime. This disruption can lead to several sleep-related problems, such as insomnia. RLS makes it difficult to fall asleep and stay asleep, leading to chronic insomnia. Fragmented sleep. Frequent leg movements can fragment sleep, preventing the individual from experiencing deep, restorative sleep. Daytime fatigue. The poor sleep quality associated with RLS can result in daytime fatigue, drowsiness, and reduced alertness, affecting daily functioning. Worsening of RLS symptoms. Interestingly, the relationship between RLS and sleep is bidirectional. While RLS can disturb sleep, sleep disturbances can, in turn, exacerbate RLS symptoms. The fatigue and increased stress levels resulting from poor sleep may intensify the sensations in the legs, creating a vicious cycle. Impact on mental health. Prolonged sleep disruption due to RLS can also lead to mental health issues, including anxiety and depression. Coping with chronic sleep disturbances and the discomfort of RLS can take a toll on an individual's emotional well-being. RLS in children and adolescents. Often overlooked. RLS is not limited to adults, it can affect children and adolescents as well. However, it is sometimes overlooked or misdiagnosed in younger individuals. This can be attributed to a lack of awareness about RLS in pediatric populations. Symptoms in children. Children with RLS may experience similar symptoms as adults, including the urge to move their legs, discomfort, and sleep disruption. However, they may find it challenging to describe their sensations accurately. Instead, they might use terms like creepy crawly or itchy to express how their legs feel. Impact on school performance. RLS can affect a child's school performance due to daytime fatigue and difficulties concentrating in class. Teachers and parents may attribute these issues to other causes, further delaying the diagnosis of RLS. Special considerations. When treating RLS in children and adolescents, healthcare providers must consider factors like growth and development. Medication options and management strategies may differ from those used for adults. Research and advancements. Advancements in treatment. Ongoing research into RLS has led to significant advancements in treatment options. Medications, such as dopamine agonists and alpha-2 delta ligands, have been developed to manage RLS symptoms effectively. Genetic studies. Genetic studies have identified specific genes associated with RLS, shedding light on the hereditary nature of the condition. Understanding the genetic basis of RLS can pave the way for more targeted therapies. Comorbidity with other conditions. Researchers are exploring the connection between RLS and other medical conditions, such as cardiovascular disease and mood disorders. Understanding these comorbidities can lead to more comprehensive treatment approaches. Non-pharmacological interventions. Studies have also emphasized the importance of non-pharmacological interventions, including exercise, dietary adjustments, and relaxation techniques, in managing RLS. These approaches offer alternative solutions for individuals who prefer non-drug treatments. Get access now, learn more. Conclusion. Restless Legs Syndrome is a condition that affects millions of people worldwide. By understanding its causes, symptoms, and treatment options, individuals with RLS can take steps towards managing and improving their quality of life. Seeking medical advice is crucial for those who suspect they have RLS to receive the support and guidance needed to cope with this condition. FAQs. Is RLS a serious medical condition? RLS is not life-threatening, but it can significantly impact one's quality of life, especially when left untreated. Can children have RLS? Yes, RLS can affect children and adolescents. It is essential to seek medical advice if your child exhibits symptoms. Your health matters for us. Quali.health